Welcome, welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, you can definitely WhatsApp on 922681060. My dear friends, you know that this is the very interesting serial that Dr. Deshpande has made regarding the clinical examination of the patient. When any patient comes to the general practitioner, we are not talking about hospital cases. We are talking about general practice, family physician, general practitioner. So what the patient will come, how he will come, what are the complaints, and how the doctor will start thinking about the differential diagnosis or the causes, how he can perform the examination, what type of the management, what type of the investigation, many interesting things. Today we have the case of 7-year-old male child. Child is there, come on, with the parents, with the father. Okay, they entered and they say, Doctor, my child is having fever and sore, severe throat pain, and he is not able to even food for last 2 days. Try to understand. The patient complaining that child is having fever plus severe throat pain, that it is very difficult to eat even the food. So naturally, when the child is not eating, the parents are restless. When the child is having fever, parents are always restless. So we are talking about the throat infection. So naturally, there are 2, 3 points come into the mind. Simple thing may be pharyngitis. Another thing is a tonsillitis. The outdated now disease is called as a diphtheria also possibility. Then if the voice has been changed, that can be the laryngitis. So many things. But let us start to, doctor will ask the different questions, history taking, interrogation. So I asked the father, did this particular your child has a similar type of attack, throat pain attack in the past also? Yes, doctor. Yes. I remember he getting sometimes this type of the throat pain intermittently. I think the last attack was say 2 months back. Okay. So the doctor immediately think in his mind that this child may be having recurrent acute tonsillitis. What is the provisional diagnosis in the mind? Recurrent, that means again and again, acute tonsillitis. Now, tell me whether he has any cough. No, doctor, not that much cough. Okay. Then doctor will touch by his back of the fingers on the forehead of the child and also the neck to check get the what you can say, the fever or the pyrexia or the hotness of the body. In spite of putting all the time thermometer, doctor can easily check clinically by the back of the fingers the temperature of the patient and can inference that it is a mild fever, moderate fever, or the severe fever. Okay. Now, next question the doctor can ask. Actually, see my child, you show me where it is exactly paining. Tell me the exact where you feel the pain. I can ask to the child. In tonsillitis, the child will point just below here. Can you see? Just below the angle of mandible on both the sides. Tonsil. Just below the angle of mandible on both sides, right and left. Okay. Okay. Then doctor can gently palpate by his own hand below the mandibular angle. So doctor will try whether there are tonsillar lymph nodes, and whether they are tender. That means if the doctor is palpating, the child will cry or child will shout. That is tenderness. So tender tonsillar nodes is one of the important signs for the cases of tonsillitis. Okay. Then naturally the doctor will proceed further and the doctor should ask the child to open the mouth, put the tongue depressor and the torch and say ah. So doctor can check with the tongue depressor and bright torch, inspect the mouth and the pharynx and the tonsils. So swollen, mildly red tonsils indicate chronic tonsillitis. Swollen is there, but they are not very great red. Only mild type of the redness is there. But if there is a angry red mucosa and swollen tonsil, that is acute tonsillitis. Then if only one tonsil is swollen and that particular redness is exceeding beyond the tonsil, redness is spreading further below beyond the tonsil, then doctor can suspect tonsillar abscess. Okay. If by chance, nowadays it is very rare, but white patch, then doctor can suspect the diphtheria. Because of the immunization, vaccination, diphtheria is nearly very less in the society. Okay, then doctor will go further and he will try to lie down the patient, lie down the child, and by stethoscope he can auscultate cardiovascular system for the heart sounds, lub dub, respiratory sounds, whether there are any RAS, rhonchi or creps. Because RAS, rhonchi, creps indicates there is a pathology also in the lung region. Rhonchi are the dry sounds, then the RAS are the wet sounds because of the fluid inside, and the crepitations is also a variety of RAS. So in Ayurveda, rhonchi are called as a Vataja Dhvani and RAS are called as a Kafaja Dhvani. So near about, doctor's diagnosis is complete, provisional clinical diagnosis that this is the case of chronic or the maybe according to the red and hot, that acute tonsillitis. Tonsillar lymph nodes should be palpated. Then there is a differential diagnosis, pharyngitis and laryngitis. Okay, upper respiratory tract infection. So diphtheria is nowadays very less. Then doctor should check the respiratory system, cardiovascular system. Okay. Now, in these cases, basically in the olden days, the best treatment was penicillin for tonsillitis. If the tonsils are very big, both right and left, and they are meeting to each other, like they are called as a kissing tonsils. Very interesting word. Kissing tonsils. Very interesting word. In the kissing tonsils, most of the times the patient should be referred to the ENT surgeon for tonsillectomy, removing of the tonsils when there are kissing tonsils. Okay. Now, one can also try to take precaution. Why we should give penicillin? Because after tonsillitis, if that streptococcal infection remains untreated, that can give rise to the rheumatic arthritis or rheumatic fever. I have the separate video for rheumatic fever. You can check it out. Okay. Then the simple symptomatic advice can be given. Ask the child to make a gargling with the salt water. Also, steam inhalation can be done to decongest that particular thing. Then antipyretics like crocin can be given. Combiflam, non-steroidal anti-inflammatory drug, NSAIDs can be given. If there is a little bit cough, then cough syrup can be prescribed. Then if the attacks are repeatedly or the kissing tonsil is there, then better way ENT surgeon recommendations, and ENT surgeon may advise tonsillectomy to get rid of this chronic and recurrent infection. So my dear friend, this was the very small video regarding explaining you about the child problem, that is tonsillitis. So my dear friends, I request you to like this video, share this video, and don't forget to subscribe my YouTube channel to boost my energy. You are my energy boosters. So thank you very much. We will see you in the next video. Till then, take care and thanks a lot.